We're back now, and it's my great pleasure to reintroduce the Senate Minority Leader from Massachusetts, Senator Bruce Tarr. And Senator, welcome back.
Thank you, Rick, and thank you, Bill. It's great to be with you again.
We'd like to get started on any updates that you might have out of the State House with respect to the governor, the administration, so on. There's been a lot happening since we talked to you last week, and maybe just a quick update on your latest.
Well, thanks, Rick. There is a lot to talk about, and I'm happy to share it with you and appreciate the opportunity to share it. So in the legislative category, yesterday was actually a big day in the Senate because we gave final passage to a bill around data collection relative to COVID-19 so that we can look at a number of different factors in terms of who's getting care, who's getting tested in facilities like hospitals and nursing homes and assisted living facilities. And the bill covers some things that the administration is already doing, but it adds others as well. And importantly, it requires the data to be collected and then put out on the web so that we can all see it. And the idea behind this is that COVID-19 is affecting different populations in a disparate way. And so we're trying to pay particular attention to people of color, people of low income, people that might be in one geographic location as opposed to another, because everyone needs to be addressed effectively in this pandemic. So the bill does that. It collects the information and puts it out so we can all see it, but it also creates a task force to be able to look at inequities. And the way that I've been expressing this is the data helps us to plug gaps right away, and the task force will help us to plan so that they don't ever happen in the first place. So this is a really important bill. It's on the governor's desk now. The House had approved it earlier. We approved it yesterday. And it's also significant that we approved it in a formal session. And you know that those have been rare. And right now we're doing it by allowing folks to vote in 3 different ways. One, you can be on the floor of the Senate. 2, you can be in your office and call. And 3, you can send a letter to the Senate president stating how you'd like to vote. And that system is not perfect, but it's been working pretty well. So there's one update, is that data reporting and task force bill, that's on the governor's desk. A second thing that's important that happened this afternoon is that the governor and lieutenant governor announced the guidance for hotels, motels, and restaurants. Now, they aren't going to be opening until phase 2, and that means we still have to have things go in the right direction. And it could happen as early as the June 8th, maybe a little bit later than that. But it won't happen unless we continue to make progress on the health matrix, and we can talk about those if you'd like. But the point of today was to give a perspective to the people that are going to have to live with those requirements as to what they look like. And many of them wouldn't surprise you. They're social distancing, the availability of hand sanitizer, making wash stations available, and doing a whole host of things that make good common sense. And it also appears that restaurants will be allowed to start with outdoor dining. And that way they can have more social distancing before they welcome people into their facilities. And I want to say I'm particularly proud of all the input that people in our region have had relative to this plan. So for instance, the folks at Beauport Hotel provided a lot of information and a lot of thoughts on this. Folks from different restaurants on Cape Ann really gave us a lot of information. So that's really important. And then the last thing that I want to update you on is critically important, and it's not so positive. And that is, you may have seen in the news, in other news sources that are not MSO, which once in a while I do look at those, and you may have seen that there's a scam going on, and it is insidious. And it involves people, we think it's emanating from Nigeria, where there's a syndicate that is filing for unemployment benefits in the name of people who have had their identity stolen through a data breach. And so what's happening, people have been getting a letter saying, we received your application, but they never filed an application. Or if they did, they had already filed one and they're receiving benefits. I don't even think I have words for how bad this is, because it's taking money away from the system, and people are really depending on this right now more than they usually do. It also slows down the process. because the folks at the Unemployment Insurance Division now have to ask for more information and verify. And if it's a redundant or duplicative application, it might knock someone out for a while. This is really bad. Now, here's the thing. We want to make sure that people report this happening so that we can try to bring some law enforcement to the table here. And I apologize for using notes, but I'm going to read this so I get it right. There is a website to report this behavior, and it is mass.gov/unemployment-fraud. And I'll read that once more. And I know with the genius of Bill Newell and Rick Moore, this can be put up on some sort of a line on the screen, but I'll just read it again. So it's mass.gov/unemployment-fraud.
Mm-hmm.
And you can also call the customer service department at DUA, and that number is 877-626-6800. I repeat, 877-626-6800. So, Bill and Rick, we really want people to report this. And obviously, we're trying to work with everybody that's had this happen, and they can always call my office. We have some really dedicated people working on this. And just to reiterate, our number is 617-722-1600. So this is really bad, and we want to make sure it gets reported, and we try to deal with it together. Now,
and again, go ahead,
Bill.
Senator. I'm sorry. Go ahead. I'll let you finish. I'm sorry.
Just one last thing in a related way. If you do not have information on file with the IRS relative to direct deposit or where your stimulus check can go to, it's been coming out in the form of a debit card.
Yeah.
And a lot of people don't realize, they think it's junk mail.
Yep.
They don't realize what's in it. So what we're going to do shortly, and we'll post this on social media, on tartalk.com and also on Facebook, we're going to take pictures of what the card looks like and what the envelope looks like, so people don't throw away their stimulus check because it came in the form of a debit card. I've talked a lot, gentlemen. I'll stop there for now.
Well, I wanted to pick up on two things here. I was going to ask you a data question, but before I do that, just to be clear again, what you were just talking about, your last point was on the fraud for the unemployment, where the fraudsters, if you will. And by the way, Bruce, we did cover this story the other day, but in a different kind of way. But you're right, it's a terrible story. But so in other words, they hack into your account, file for unemployment under your name, and take that money, and then you get notified that you're on an unemployment, but you're really not getting any money for being on unemployment. So it's just it's quite a scam, that's for sure. Let me ask you about a data question, Senator. And so we have data over the COVID-19 over the span of two months plus. We have regional data. We have the data that you're looking at and the governor's looking at and his administration is looking at for, let's say, reopening restaurants. So of these data points, what kind of stands out at you looking either at it right now or looking at it over a period of time and regionally?
So one of the interesting things is, and I'm looking for the chart right now, and I'll go through these, Bill, for a second. So there are essentially 6 factors, just so we remember that. One is the COVID-19 positive test rate. One is the number of individuals who have died from COVID-19. One is the number of patients with COVID-19 in hospitals. One is healthcare system readiness. One is testing capacity. And one is contract tracing capabilities. Of those 6, the majority of them, 4 of them, are in the work in progress category. Only 2 have a green light. And so the way this is done, it's like a traffic signal. So there's a green light for we're doing good, there's a yellow light for caution, and there's a red light for bad. And right now, the COVID positive test rate, that's green. So we're doing well with that. And testing capacity is green. That's a positive trend. The others at this point are all still works in progress. So what I would say, and if you look at the dashboard on mass.gov, Bill, and I would encourage people to do it,
Yep.
There's an unbelievable amount of information. But there's one page that shows the weighted averages for these 6 things. And they're all moving in the right direction. And so what stands out to me most of all when you ask is hospital capacity. Right now we see the field hospitals are starting to close. The hospitals feel like they have enough capacity to deal with what they need to deal with. Now, importantly, the field hospitals are not being totally dismantled because we don't know what's going to happen in the fall. But right now, hospitals have good capacity. And they would want me to remind you that if you have an emergent medical situation, they can treat you. Don't stay away. Because one of the concerns that's emerged over the last couple of weeks is people avoiding the hospitals because they think the only thing that can be treated there right now is COVID-19. And there's a lot of folks in the healthcare professions that are really worried about that. So the thing that stands out for me the most is what a good job people have done flattening the curve and how that's resulted in a lot of good hospital capacity around the state.
What about what about reopening hospitals for the elective surgery and all the procedures that are not taking place? Not the emergencies that you're just talking about, but moving forward, because they've laid off a lot of that staff, I believe.
They have, and that's been one of the discouraging things is that medical professionals who we need and who are on the front lines, some of them have been furloughed. And that's because a lot of those elective surgeries have not happened. They are slowly coming back. And in order for them to come back, the hospital has to provide an attestation of various things, the conditions that need to be met. And certain kinds of elective surgery are able to come back, and also preventative kinds of things are able to come back. But it's not everything. And the inability to do elective surgery has taken a real toll on the budgets of our hospitals because they depend on those things for a lot of revenue. They haven't been able to get it. So they're starting to reopen, starting to be able to do that with specific guidance. And as long as they make an attestation to Department of Public Health that they're capable at this point of doing that. And what's in that attestation, Bill? Things like, do you have 2 weeks of personal protective equipment? So that we can say there's a comfort level there, a margin that you can withstand an influx of patients. If you don't, then it's not allowed to happen.
Senator, final question for me is last week you mentioned the Mass Tech Collaborative, I believe it is. I talked with some people in Gloucester trying to reopen, a couple on the waterfront, and they were concerned about getting protective personal equipment for their boats because they have to supply them to their clients and so on. So what's the status, if you have one, update on the PPEs in terms of reopening businesses? How does that work?
You know, it's a great question, Rick, and I'm glad you asked it. So the first thing that's happened is on mass.gov, on the reopening pages, there is a specific page that lists all of the people in Massachusetts that are selling the things that businesses need to reopen: hand sanitizer, PPE, masks, gowns, gloves. So folks can go there to find those things. I personally think we need to do more. And you may know, because I think we've talked about it in the past, that on the part of the Senate, I actually chair the working group on supply chain issues. And we developed a memo that's been sent to the Reopening Advisory Board and to the governor and lieutenant governor, suggesting that we may be well advised to create a clearinghouse so that state government purchases things in bulk and then distributes them at cost to the businesses that need them. Now that has multiple advantages. One, it gives us leverage in the marketplace. Two, it makes it easier for folks to find it because it would be one-stop shopping. And three, it would avoid competition between healthcare providers and businesses, because we all know how critical the supply of PPE has been to healthcare providers. Now we have all this group of new people coming into the market that need these things, and what we're suggesting is we should look at the next step, which is centralizing procurement the way that we did for healthcare institutions to do that for businesses. Again, not to give it away, but just to realize economies of scale and make it easier for businesses to reopen.
Senator, once again, we thank you for your time. Look forward to doing it again.
Thank you both very much. Look forward to it. It's always great to see you. Great to spend time with you. And hope folks have a good weekend.